Now, in the first, when you began to talk about it, I was hearing your cognitive behavior therapy roots. So that's
Yeah,
one part of this approach
yeah,
of compassion focused therapy is
yeah,
that I can hear that at least as you teach it and practice it, there's a lot of CBT, right?
yeah.
Cognitive behavioral therapy. I'm wondering if there are people who start with a different base, or there are people who start from, say, a psychodynamic base, and if that would look different from the outside or the inside.
Oh, yeah, it's a great question. Yeah, I mean, I think the way, basically, our approach is really to bring this orientation to whatever therapy you're doing, because our view is that it's a little bit like climbing Mount Everest. You can teach people how to climb, you can give them wonderful ropes and boots, but if they're unfit, they're never going to make it. So if they're not able to create some kind of stable, compassionate base, then when they try to engage in the cognitive or the behavior stuff, it just overwhelms them because they don't have enough inner stability. They don't have enough, they just become very self-critical or hostile, or I can't do it, or they don't have enough of this, what we would call mental fitness, to be able to do the stuff they need to do. Now, that's important. So when whatever therapy you're doing, whatever therapy you're engaging in, we would argue that if you do this training, what we call compassionate mind training, they are fitter, they're stronger, they're more able to do the therapy that you have. So the
Yeah.
psychodynamic people will focus more on allowing people or enabling people to notice certain kinds of emotions or memories arising as they arise. But what we find is that in the end, that from whatever therapeutic background you come to, there is this movement towards understanding that if you can create this inner compassionate state for people, they will find their own wisdom. Sometimes you have to guide them a little bit. So, for example, if you're having an argument, some therapists will teach people to pay attention to the mind of the other, to remember an argument is always a twosome, never a onesome, and to think about what's happening in the mind of the other person. Again, if you can produce this state, you'll be able to do it. If you just stay angry, then you're not interested in the mind of the other person. You just them listening to you. So I did a lot of training in Jungian archetypal psychotherapy as well. So
goody! That's one of my favorite topics.
So I did training in that for a number of years. So
interesting.
That's some of the evolutionary stuff that you see in the work that we do is really the base. How do you move the basic archetypes around? So compassion really is an archetype. That's another way of thinking about it.
Yeah, that's interesting that you don't see an incompatibility there.
No.
Nor do I.